MEK inhibitors transformed treatment for BRAF-mutant melanoma, yet many patients still see their cancers progress. What holds these drugs back? Here is the paper itself. MEK sits in the middle of the RAS-RAF MEK-ERK cascade, turning upstream signals into the final commands that tell cells to divide or survive. Before 2026, clinicians relied on BRAF-MEK combos for V600 melanoma, while patients with CRAS or NRAS mutations often got only chemotherapy, immunotherapy, or experimental regimens, because single-agent MEK drugs were limited by side effects and resistance. Chan and colleagues asked whether smarter combinations, better biomarkers, and new drug designs could unlock MEK inhibition for a wider range of cancers and even non-oncologic diseases. The authors performed an exhaustive synthesis of trial data, mechanistic studies, and emerging combination strategies, comparing each approved MEK inhibitor against standard comparators and reporting response rates, survival benefits, and adverse events. Across the trials, efficacy was quantified by RECIST-defined tumor shrinkage, while durability was captured with median PFS. Safety was graded using the common terminology criteria for adverse events, focusing on dermatologic, gastrointestinal, ocular, and cardiopulmonary toxicities. A striking highlight: in a pediatric NF1 trial, 71% of patients achieved a confirmed partial tumor response to selumetinib, showing that certain genetically defined tumors are highly sensitive to MEK blockade. Figure 1 from the review illustrates that roughly 1/4 of all cancers harbor alterations in BRAF, CRAS, NRAS, or NF1, underscoring why the MAPK pathway is such a compelling therapeutic target. Figure 2 maps the cascade from receptor tyrosine kinases through RAS, RAF, MEK, and finally ERK, highlighting the multiple feedback mechanisms that can reactivate the pathway after MEK inhibition. Figure 3 shows where activating mutations cluster in MEK1 and MEK2, many of which confer resistance to early-generation inhibitors, guiding the design of newer allosteric drugs. In BRAF V600 melanoma, MEK inhibition shines when paired with a BRAF inhibitor. Monotherapy yields modest response rates, around 40%, but combination regimens boost ORR to 70% and extend progression-free survival beyond a year. For NRAS mutant melanoma, the NEMO trial showed a modest improvement in response and PFS with binimetinib, yet the survival advantage remained absent, reflecting intrinsic resistance mechanisms. Across trials, severe skin rash, diarrhea, fatigue, and eye problems were the most frequent high-grade toxicities, leading many clinicians to lower doses or interrupt treatment, especially when MEK inhibitors were combined with other agents. New trials pair MEK inhibitors with PD-L1 blockade or PI3K-mTOR inhibition, aiming to overcome feedback reactivation and improve durability, though early data show mixed efficacy and heightened toxicity. In practice, the strongest evidence supports MEK inhibition as part of a BRAF-MEK combo for V600 melanoma, while NF1-associated tumors represent a niche where monotherapy can be highly effective. Vigilant toxicity monitoring remains essential. The authors acknowledge that their work is a synthesis of existing trials rather than a new head-to-head study, and that variations in patient populations, dosing schedules, and endpoints limit direct comparisons. Biomarker-driven selection is still in its infancy. Looking ahead, The field aims to design MEK inhibitors that avoid feedback activation, pair them with precise biomarker panels, and expand their use into fibrotic and developmental disorders where MAPK signaling is also dysregulated. Summarizing, the evidence supports combined BRAF-MEK therapy for V600 melanoma, highlights a clear niche for NF1-associated tumors, and cautions that emerging combos must balance efficacy with safety. These 3 rules capture the practical guidance distilled from the review, helping clinicians decide when and how to use MEK inhibitors safely and effectively. We thank Dr. Chan, Dr. Da Silva, Prof. Long, and Prof. Rizos for their insightful synthesis, and we appreciate the Lancet for publishing this important work.